Welcome to this video. In this video, I'll be sharing 8 major concerns of the new parents. So, the 8 major concerns that the parents have, first out of it is, why has my little one lost weight in the first week? Remember, you had a very sweet, puffy, and chubby baby when the doctor handed over the baby to you for the first time. And at the end of the 3 days or 4 days, probably somebody around you might have told you, "Hey, your baby has gone weaker." That's a very common comment that you get, and you get anxious about why has this happened to my baby. But the fact is, at this point of time, at the age of say 3 to 4 days after birth, all babies naturally lose 8 to 10% of their weight, and they regain rather this weight at the age of 7 to 10 days, and thereafter they will start gaining this weight to the tune of say 20 to 30 grams or maybe 40 grams in a few cases per day. 20 to 40 grams per day, then that will be the gradual weight gain till the age of 3 months, and I will be talking about this in my subsequent videos, how does the weight grow beyond that. And this second most common concern is, why does my little one cry while passing urine? Yes, this is a very common entity that has been asked during all these 20-21 years by the mothers while I have been practicing pediatrics. So this again is a very normal sort of scenario. Actually, what happens is, baby has distended urinary bladder, and that point of time baby feels a bit awkward, and that's why he cries. And as soon as baby passes the urine and the baby gets relieved and stops crying. But at the same time, if the baby is crying while passing urine, that is not good. That raises the suspicion of UTI, urinary tract infection. So in this scenario, if the baby is crying while baby is passing urine, you need to consult a doctor. He will get a urine examination done and probably put the baby on some medications if required. And if the baby is if the baby is crying before passing urine, then it is absolutely all right, and you need not worry. Concern number 3, can I give bath to my little one when I reach home? But doctors say that you need not give bath to the baby till the umbilical stump falls off. So that may happen in say 7 to 10 days. Till then, you can just sponge the baby and clean the baby, and that too very mildly and that too very softly. And you should not vigorously try to clean the skin of any other materials, sticky materials that you think are not required. And when you give bath to the baby, the first thing you need to make sure is that your baby is not in a say very airy sort of room. There are no draughts of air inside, and the room or the environment should be quite warm, and it should not be a very long procedure. You should just give a quick bath. First of all the body parts below the neck should be cleaned and washed off or given bath, and in the end it should be head made wet, and then immediately wipe it off and make it dry. Remember, I told you that head has the largest surface area. When doctor received your baby at the time of the birth, he just cleaned off the head area first of all, and then made sure that the baby doesn't lose much of the weight so as to cause hypothermia. Hypothermia means the extreme cold temperature that baby gets. So the point to remember is, no need to give bath for first say 5-7 days till the stump falls off, and then when you start giving bath, it should be quick procedure, and head should be washed off last and wiped first of all, right? So the next point is number 4, can I use cosmetics? Primarily the point of mother is that whether she can use some soaps, oils, or talcum powders or prickly heat powders. So you should use all these cosmetics to a very minimal extent. Number 1, you should use the soap which has very mild pH. It should be non-medicated, non-perfumed sort of soap you should use. And the second, you can use any oil, any commercial oil, any desi oils that you have got in your house, but avoid using mustard oil. Third is do not sprinkle talcum powder on the body, because when you sprinkle talcum powder on the body of the baby, then you just tend to put a lot of talcum on the body, and the body has small pores to just put off the sweat out of the body, and you tend to block those pores, and baby skin gets affected with that. So what you need to do is sprinkle talcum powder on your hands and on your palms, rub your palms gently, and then gently apply on the body of the baby, so that there will be only a small thin layer of the talcum on the body of the baby. Remember, do not sprinkle on the body. Number fourth is avoid prickly heat preparations. Why? Because these prickly heat preparations, they contain boric acid, which can be injurious to the health of the baby. Number five, my little one is spitting up after every feed. What to do? So, if the baby, actually it is a very normal sort of thing which is happening, because baby tends to take, sometimes tends to take more feed than required. उसको पता नहीं चलता कि कितना दूध चाहिए. Sometimes it happens so. And what happens is after the feed, when you just pick up the baby and put on your shoulder for burp, or just make him sit in your lap, baby immediately spits a bit of milk. So that is absolutely normal, but make sure that your baby is gaining weight adequately and passing urine adequately. Baby weight adequately means 20 to 40 grams per day, and urine output normal means 6 to 8 times in 24 hours, right? Point number 6, my little one is passing stools frequently. What should I do? This is a normal process in the babies, newborn babies. First 2-3 days, babies are not taking enough of the milk, and at that point of time, say for the duration of first 3 days, baby might not be passing more than 2 stools per day or 3 stools per day, and that color of the stool in that scenario is also a bit blackish green, and you should not get worried about the color at that point in time, because that is the color of the meconium, that is the initial stool that every baby passes for first 2-3 days. And subsequently 3 days onwards, 4 days onwards, when baby has started accepting normal breastfeeds and other feeds, then the frequency of the stools that gradually increases. That varies from say 3 to 4 times up to 10 times in a day, and that will happen immediately after say when you give feed, baby will just pass the stools, and you get worried that all the feed that I have given that has just passed off, but that's not the scenario. That is a normal gastrocolic reflex, and that is absolutely fine. Again, the tip over here is, if the baby is passing, say gaining weight adequately, this means baby is actually developing in a normal way, and baby is passing urine 6 to 8 times in a day. Both these are good indicators to for you to assess that everything is fine and you need not worry. And the point number 7 is, my little one is having swollen breasts. Is it worrying? This is again a very common and point where mothers get worried about. And there is one more thing that usually is happening in the homes, is that somebody who is coming for the massage or some support for you as a mother, or some elderly in the house, they tend to advise you to squeeze it off, to squeeze and just bring that material out, and that is not good, they say so. But as a doctor's advice, I would say big no to this, because that creates a sort of environment in the breast which attracts infections, and that is really a very big problem sort of thing. So this will get all right of its own, and you need not squeeze these say lumps of breast that get swollen. This happens both with boys and girls. This can happen, and this is absolutely normal, and it will get all right of its own. Last point, my little one has rash and I am worried what to do. Yes, definitely a few sort of rashes they occur. The most common of rash that you see is in the perianal area. Perianal means around the area where the baby is passing stools. And I told you that baby might pass stools for 4 to 10 times in a day, and you tend to just wipe it off strongly. Every time you think that that you should wipe the things off effectively. So by doing so, you try to rub the skin every time very tightly and very firmly, and that erodes the skin, and that causes a sort of excoriation and a angry looking rash, and that looks worrisome. Yes, that is worrisome, but if you just mop dry and wipe do not wipe, do not use this section, rather use dabbing and mopping. Then this thing will be absolutely fine. And I usually advise that in say if it's not extreme winters, you should just wash off this perianal area every time and then mop dry with a cotton cloth. That is the best thing. I do not recommend using say commercial wipes for this region, because that again causes, wipes itself says you will wipe the thing off, and when you try to wipe the thing off, you are actually eroding the layer of the skin every time, so that will cause the rash and the excoriation. So there are two other types of common rashes that babies see, and first is this rash. Let me just magnify it. This is a small areas of say a redness and a big thick redness spots everywhere in the middle of, like this is a small island and there is a darker island over this island, and this is when you touch it might feel a bit palpable, but this is absolutely normal. You just need to wait and it will get all right of its own. The second type of rash is these sort of small whitish pustules. This one, these three that you can see. So again, as you can see, these are three in number, and we have seen that these sort of rashes, they do appear and they are absolutely normal if the number is less than 3, and if this number is more than 3 and baby is also getting fever, or maybe baby is a bit lethargic or feeding less, then in that scenario you should consult a doctor. He will rule out infection in your baby. So these are the 8 most common concerns that new parents usually come with, and if you know all these 8 areas, and I mean your concepts are clear about this, so imagine how many visits to the doctors, how many calls to the doctors that you can avoid, and that you can just analyze yourself as a first aid at your home only. And in the scenarios where I have just told you that there is the concern to be talked to the doctor, then you can just approach your doctor. So I wish you good luck, and let's move on to the next video. And before going to the next video, I wish all of you to enumerate and write down what did you learn from this video. Great. Thank you very much.